Hello there. My name is Corey Del Bianco. I am with the AUA and Urology Care Foundation, and today we are talking bladder cancer. November is Bladder Health Month. I have bladder cancer expert Dr. Kyle Richards here, and we are so excited to have him. Thank you so much for joining us. Our first question is, what exactly is bladder cancer?
Yeah, thanks for having me. And bladder cancer is a disorder, a disease, a condition that impacts the bladder. And when we're talking bladder here, we're talking about the urinary bladder. There's also a gallbladder. This is not what we're talking about. We're talking about the urinary bladder. And the urinary bladder is an organ deep down in the pelvis that primary function is to store urine and then to empty urine. And the bladder, like many other organs within the body, can develop cancers. And bladder cancer is the fourth most common cancer in men and the ninth most common cancer in women. So it is a cancer of the bladder, and there's varying levels of severity of bladder cancer. And really, what is a cancer? Well, a cancer is an abnormal growth of cells within that tissue or organ of origin.
Thank you so much. Now, what could cause bladder cancer?
There are several potential causes of bladder cancer, and in the United States, the most common cause of bladder cancer is actually smoking. In fact, maybe up to about 50% of patients with bladder cancer are smokers or even former smokers. And this could be primary smoking or even secondhand smoking could be a risk factor for bladder cancer. So smoking is one of the biggest risk factors for bladder cancer. There are also other occupational hazards. So if you have a job where you're breathing in noxious fumes, chemicals, paints, dyes, if you work in a factory and you're breathing in fumes that possess certain carcinogens, and you're not wearing a ventilator or other protective equipment, over time, those fumes can lead to cancers, including bladder cancer. And then there are certain environmental risk factors as well that we're starting to learn more and more about. Pesticides, things in the water supply, things that we need to potentially look into with more research to try to figure out some of the environmental causes of bladder cancer.
Now, in addition to all the things you just mentioned, are there other certain populations that are at a higher risk?
Patients that are getting older are at a higher risk of bladder cancer. Bladder cancer, the average age of diagnosis is around age 70, so it is definitely a cancer of aging, but you can get it at any age. In fact, I have patients as young as 20 in my practice of bladder cancer and as old as 99, but on average it's in the 70s, so it is a cancer of aging. Also, patients that have indwelling tubes. So if you have an indwelling catheter in the bladder for various reasons, that could put you at an increased risk of bladder cancer over time. Also, patients that have recurrent urinary tract infections could potentially be at a higher risk of bladder cancer. And if you're a patient that does have issues with bladder infections and they don't seem to be getting better with treatment, it would be a good to seek advice from a urologist to make sure that it's not actually bladder cancer.
What are some signs or symptoms that people should be looking out for to reach out to their doctor?
So the biggest red flag for bladder cancer is blood in the urine. So if you ever see blood in the urine, it's not normal. Even if it goes away, it's not normal. It should be evaluated by a urologist. And that's the key take-home message here is if you see blood in your urine, even if it's just a little amount or even if it goes away within a day, don't just brush that aside and say, well, it was probably nothing. The other thing I will say is, as I mentioned before, if you have recurrent or repeat infections in the bladder, also if you have a lot of, pain and burning with urination and it doesn't seem to be getting better, or frequent urination, and it seems to be getting worse and worse. Those also could be potential signs or symptoms of bladder cancer, and reasons to get that checked out. Um, Also, I will say that women do get bladder cancer, and oftentimes they can have a delay in their diagnosis because, first off, bladder cancer is less common in women, but and oftentimes women are assumed to have either a benign, non-cancerous cause of their symptoms, like urinary tract infection or gynecologic uterine, you know, that type of thing. So so women can get bladder cancer, and if they have blood in the urine, they should definitely be evaluated by a urologist as well.
Now, how do you get tested to see if you do have bladder cancer?
If there's a concern for bladder cancer, there's a few tests that we do routinely to evaluate for that. In fact, there's really two main tests. So one is called a CT urogram or a CT scan. Some people say a CAT scan as well. And basically, that's a specialized X-ray to evaluate the kidneys, ureters, and bladder, the entire urinary tract. And the second test that we do is something called an office cystoscopy, or cysto for short. And this is a procedure that's done in the office under local anesthesia. So the patients are awake for the procedure. Procedure is a little bit uncomfortable because we have to insert a small scope into the urethra, into the bladder, but the procedure is over usually within 2 to 3 minutes. So it's a very quick procedure. It's a little uncomfortable. We do use some numbing medicine to help numb things up, and patients generally tolerate it quite well. And so those are the two main tests that we do to evaluate patients for possible bladder cancer.
Now, if you find out you do have bladder cancer, what are some treatment options? Do you always need surgery?
For the patient that is newly diagnosed with we usually say a bladder tumor, think it maybe looks like bladder cancer. Really, the first step is to remove the tumor. So if the patient is a surgical candidate and wants to learn more about their bladder tumor, really we need to remove it so that we can get some sense for, number one, confirm that it is bladder cancer, and then number two and number three, we want to know what type of bladder cancer it is, because there are different types. We also need to know what the grade and the stage is of the cancer. So the initial procedure is an outpatient surgery where patients are typically under a general anesthesia. And once again, we put a scope into the bladder through the urethra, so there's no cutting or incisions on the outside of the body. And through that scope, we're able to remove the tumor. And we try to remove the entire tumor so that we can send it off for analysis. But also, that procedure is part of the treatment for bladder cancer. So it's not just a diagnostic procedure where we just take a sample. We do try to remove the entire tumor so that we can get a sense for what type of bladder cancer this might be, as well as the severity of it.
Now, you mentioned there was different types of bladder cancer. Can you explain that?
So in the United States, about 90 to 95% of bladder cancers are called urothelial carcinomas. And the cells that line the bladder are called urothelial cells. So when they turn into cancer, they're called urothelial carcinomas. So the vast majority are of that variety. And then the minority of bladder cancers, the other maybe 5% that we see in the US, could be different types, like squamous cell carcinoma of the bladder. You can get adenocarcinoma of the bladder, small cell of the bladder, and these other types of bladder cancer behave differently. So it's important for the urologist to understand that, as well as to help counsel the patients, because the behavior of the cancer is different based on the different type that you might have.
Now, is there ever a situation where the bladder has to be completely removed?
Removing the entire bladder is something that needs to be done, but not for everyone. In fact, the vast majority of patients that have bladder cancer were able to preserve their bladder, because the bladder that you're born with is really better than pretty much any bladder that we can reconstruct or build or make. So our goal, and I think many patients preserve bladder preservation, and that's our primary goal. If we think that it's safe and feasible, but there are some patients where their cancer is more advanced or more aggressive or more active, and to save their life, we do need to remove the bladder in those instances. And so that's a discussion that needs to be had based on each individual, because it's really the cancer, the biology of that cancer, the cancer characteristics that really drive that decision making and discussion between the patient and the urologist.
And if the bladder has to be removed, what options do you have with urinating? Is that going to affect that?
So if the bladder does need to be removed, if that's the best option for trying to eradicate the cancer and provide a cure, there are several options for urinary reconstruction, because once the bladder is out, you still have to urinate or pee. And there's three main options that are done to reroute the urine. The first option is something called an ileal conduit or a urostomy. That's the simplest of the three. And all three we build out of the patient's own intestinal tract. So we borrow a different piece or segments of the patient's GI or intestinal tract to build this. In the ileal conduit, we borrow a piece of the small intestine, and then we sew the ureters, which are the kidney tubes, into one end, and then the other end we actually bring out through the skin on the right side of the stomach as a stoma. And patients will wear a bag over the stoma so that the urine will just trickle through that into the bag. Another option is something called a neobladder, which stands for new bladder. So we can actually build a new bladder out of a patient's own intestinal tract. And it's a little bit fancier than the first one, but we're able to use the intestines to we sew the intestine into a sphere, so it looks like a little balloon, almost like a new bladder. We connect it to the urethra so that you don't have to have a bag or a stoma, and that you can urinate more naturally through the urethra. And then the third option is something called an Indiana pouch, or a continent cutaneous urinary diversion. And to build that, we once again build that out of the intestinal tract. Intestine is once again sewed into a pouch that's all on the inside of the body. And we patients that have this option have a stoma on the right side of their stomach, but they don't have to wear a bag over the stoma. They actually catheterize, use a small tube to insert that through the stoma. And once that tube is in, then the urine drains out. And then they take the catheter or the tube out and put a bandage over the stoma so that it doesn't rub on their clothes. So that's another option. And all three are good options that patients should discuss with their urologist if they do need to have their bladders removed.
Now, my last question, if you become cancer-free, what other signs or symptoms should you be looking for to see if it comes back?
So after bladder cancer treatments, patients really need to be followed by their urologist for the rest of their lives, because our goal is to cure their cancer if possible. And oftentimes we're able to do that, but we do need to follow patients over time to ensure that they're not only having a good quality of life, but also that their cancer has not recurred. So many patients will come in to have their bladders, if they still, if their bladder has been preserved, we'll have to monitor their bladder with periodic bladder checkups where we do a scope in the office. If patients that also preserve their bladder, oftentimes will have to have periodic CT urograms to evaluate their upper urinary tract. And then for patients that do have to have their bladders removed, they won't need cystoscopy anymore, but they will need periodic CT urography and other imaging and lab tests to monitor for any potential signs of recurrence. But if a patient is experiencing any other red flag symptoms like blood in the urine, uh, pain that is out of proportion to what is normal, or if they're losing weight or having other systemic symptoms, chills, really unusual pain in their bones or joints that they haven't had previously, those could also all be potential signs or symptoms of a recurrence and would warrant a phone call to your friendly urologist.
Well, thank you so much, Dr. Richards. I know I learned a lot during all this, and I hope everyone else learns a little something for Bladder Health Month. Thank you so much for joining us, and we hope that you have a great day.
Thanks, Corey.